and welcome to this episode of Springfield Career Insights. Today, we are tackling a subject that impacts communities, economies, and global well-being, public health. In an era of evolving healthcare challenges, training the next generation of health leaders has never been more vital. We are honored to be joined by His Excellency Dr. Gandawa, an esteemed biomedical researcher and one of the key architects behind the Master of Public Health program at Springfield Research University. Dr. Gandawa, welcome. To begin, what sparked the vision at Springfield Research University to create the Master of Public Health program? What was the driving force?
Thank you, Advocate. Good evening to the viewers. It is a pleasure to be here. So the decision to launch the Master of Public Health program wasn't taken lightly. It was fueled by a deep sense of responsibility and a clear understanding of the challenges ahead. Let me share a few key reasons that ignited this passion. Firstly, we are facing unprecedented health threats, from the ever-present danger of pandemics to the rise of chronic diseases and the looming specter of environmental health risks. The world demands professionals who can create effective solutions. We envisioned a program that would empower graduates to design interventions that protect communities and fortify our health systems against these threats. Secondly, we recognized a critical leadership gap. The demand for skilled professionals who can analyze health trends, craft data-driven policies, and champion equitable healthcare is growing exponentially. Our MPH program is specifically designed to fill that void, to cultivate critical thinkers, health innovators, and policy shapers who can lead the charge. Thirdly, we firmly believe that a resilient healthcare system is built on a foundation of a well-trained public health workforce. Our MPH program goes beyond just teaching epidemiology and biostatistics. We ensure our graduates understand the intricate web of health policy, resource allocation, and the healthcare economics. This empowers them to contribute to stronger, more effective health systems, not just here in Africa, but across the globe. But it's not just about academics. It's about real-world impact. We didn't want to create just another theoretical program. That's why we have woven real-world case studies, hands-on field research, and collaborations with government and international health organizations into the very fabric of our MPH program. Our students don't just learn about public health. They actively shape it through applied research, policy analysis, and rigorous leadership training. And finally, at Springfield Research University, we are deeply committed to research and innovation. We believe in transformative education, learning that ignites action. Public health is at the cutting edge of scientific discovery and technological advancement, whether it's in disease surveillance, digital health solutions, or global health security. Our MPH students become part of this exciting innovation, conducting research that contributes to tangible, real-world health improvements. So in essence, Springfield's MPH program is more than just a degree. It's a beacon of progress. It's about equipping passionate individuals with the knowledge, the skills, and the leadership expertise to influence health policy, drive vital research, and enact meaningful change where it matters most, in the lives of people and communities around the world.
Good to hear, Professor. This program sounds incredible. But how exactly does it connect to the bigger picture? How does it align with the health priorities we are seeing on a global and regional scale?
Thank you, advocates. That's a crucial question. Our Master of Public Health program at Springfield Research University isn't just an academic exercise. It's a direct response to the urgent health challenges facing our world today. So we meticulously designed it to align with international frameworks like the World Health Organization Sustainable Development Goals, as well as the specific healthcare priorities of our region. Our aim, to equip our graduates to be true agents of transformative change in public health. Let me give you a sense of how we do this. Firstly, we are talking about safeguarding our future. Our program places immense emphasis on disease prevention and health security. Think about it: epidemiology, infectious disease control, health preparedness. These are the cornerstones of strong health systems. We need to be ready to face global threats like pandemics, antimicrobial resistance, and those emerging diseases that keep us all up at night. Our graduates will be prepared to develop proactive policies, design effective intervention strategies, and build community resilience, so we're not caught off guard by the next health crisis. Secondly, health equity for all. At the heart of everything we do is a commitment to fairness. We are on a mission to eliminate health disparities and ensure everyone, regardless of their background or location, has access to quality care. Our curriculum dives deep into the social determinants of health, empowering our students to tackle inequalities in healthcare access, affordability, and outcomes, especially in those underserved, low-resource communities that need our attention the most. Thirdly, protecting our planet, protecting our health. We can't ignore the impact of our environment. Climate change, pollution, occupational hazards. These are increasingly impacting public health and hindering global development. That's why our MPH program ensures graduates are well versed in environmental health sciences. They will be ready to develop strategies that mitigate climate-related health risks, improve sanitation, and create sustainable urban health policies that promote well-being for all. And fourthly, global collaboration is key. Springfield Research University is dedicated to building leaders who can operate on national and international stages. Our MPH program integrates cross-border health strategies, ensuring our graduates can seamlessly collaborate with international health bodies, non-governmental organizations, and governmental agencies. Because, let's face it, the biggest public health challenges require multinational solutions. This program is more than just a degree. It's a launchpad. It positions Springfield graduates as key players, ready to shape the future of healthcare, not just in our local communities, but on the global scale. They will be the leaders that we need.
Professor, Springfield boasts a Master of Public Health program in a sea of MPH programs. What makes the SRU one truly stand out?
That's a fantastic question. You see, at Springfield Research University, we don't just offer a Master of Public Health. We forge public health leaders. Our program is a catalyst, immersing students in the very real challenges, the cutting-edge research, and the vital collaboration that define modern public health. We're not just handing out degrees. We are launching careers. And by the way, In the country, we are the only institution offering the Master of Public Health degree.
Yeah, I know. And it's fascinating.
And now, here is how we do it. So first, it's our multidisciplinary approach. We don't silo knowledge. We weave together epidemiology, health policy, biostatistics, environmental health, and behavioral sciences into a dynamic, action-oriented curriculum. Our students don't just study health in a vacuum. They understand how these disciplines intersect, how they impact policy, and how they drive real-world interventions. Second, we offer hands-on research and field experience. That is unparalleled. Forget passive observation. Our students are in the trenches, from community health initiatives right here at home to collaborative studies with the health ministries across the globe. They are gathering data, analyzing trends, and crafting solutions. They graduate not just with knowledge, but with the practical expertise to tackle the most pressing public health issues head on. Third, we focus on policy simulations and leadership development. We are not just training followers, we are cultivating leaders. Through realistic policy simulations, intense health crisis management exercises, and strategic planning case studies, we prepare our students to think like decision makers. Whether it's addressing health inequalities, responding to a global outbreak, or improving healthcare system efficiency, our graduates lead with confidence and conviction. Fourth, our global collaborations and industry connections are a game changer. Springfield's MPH program is deeply connected to international health organizations, influential non-governmental organizations, and leading policy think tanks. This gives our students invaluable opportunities to engage with real-world experts, contribute to impactful research, and gain first-hand exposure to global health governance. They are not just learning about it, they are living it. And finally, and perhaps most importantly, our students actively shape public health solutions. This isn't a theoretical exercise. They are designing interventions, publishing research, and contributing to meaningful policy discussions right now. They graduate with a professional portfolio that demonstrates their ability to drive real, lasting change in the public health sector. So, Springfield's MPH program is more than just a program. It is a launchpad for leaders, innovators, and change makers who are ready to transform healthcare systems locally, regionally, and globally. It's an investment in a healthier future for all.
Your Excellency, for our viewers considering a Master of Public Health, what are the core areas of study within Springfield Research University's MPH program? What can students expect to delve into?
Well, at Springfield, we have designed our Master of Public Health program around 5 essential pillars. Think of them as the cornerstones upon which we build the next generation of public health leaders. These aren't just academic subjects. They are the keys to unlocking real-world solutions and making a tangible difference in communities, both near and far. Let me elaborate. First, we have epidemiology. This is where we become disease detectives. Students learn to unravel the mysteries of disease patterns, respond to outbreaks with speed and precision, and develop strategies that prevent illness before it even starts. Imagine being on the front line, tracking infections, analyzing trends, and protecting entire communities from emerging health threats. It's about being proactive, not reactive. Next, health policy and management. This is all about leadership. It's about understanding that effective public health isn't just about medicine. It's about strategic decision making and shaping the policies that affect everyone. we equip our students with the skills to navigate the complex world of healthcare regulations, manage health systems efficiently, and become powerful advocates for policies that ensure everyone has access to quality care. And then we have environmental and occupational health. In a world grappling with climate change, pollution, and workplace hazards, this pillar is more critical than ever. Our students learn to tackle these challenges head-on, developing innovative solutions to address environmental hazards, mitigate industrial exposures, and promote sustainable practices that protect both workers and the planet. Of course, we can't forget social and behavioral health sciences. Health disparities are a stark reality, and this area is dedicated to understanding and addressing them. Students delve into the social factors that influence health, explore mental health challenges, and design behavioral interventions that promote healthier lifestyles and create true health equity access across all populations. It's about understanding the human story behind the data. And finally, we have biostatistics and the healthy data analytics. In today's world, data is king, and healthcare is no exception. This specialization empowers students to harness the power of statistical modeling, analyze complex health trends, and leverage big data to make informed, impactful public health decisions. They become the storytellers of data, translating numbers into meaningful action. But here is the crucial point. Springfield's MPH program isn't just about theory. Each of these pillars is interwoven with the hands-on research, real-world fieldwork, and practical policy applications. We want our graduates to emerge not just as academics, but as leaders ready to step into the arena and shape the future of public health, both globally and right here at home. They leave here prepared to make real, lasting impact.
Thank you, Professor. Let's take a break and listen to a song called Springfield Phakama.
Springfield Phakama, ngenekhaye kusasalia visa. Springfield ukinile, siphiliza izindonga, asipheli mandla, siyaphakama, sizalelwe ukhola, siyangoba, liyashaya ya ilanga, umsebenzi uthathile, amazwe aseSpringfield, siyajabula kakhulu, akukuhlehla, akukuhlehla. akukubetha kwesibili izingwadi namaphupho amandla phezulu sifinyelela izinkanyezi sithinte sibhakabhaka sizomdlandla izomdlandla izomsindo esisinyathelo samazamisa umhlaba phakama manje thatha indawo yakho umlilo we-Springfield sibeke sinina amaphupho ayavutha isikhathi lesi ola impimpi thatha umkhela manje thatha indawo yakho umlilo we-Springfield sibeke sinina amaphupho ayavutha isikhathi lesi ola impimpi thatha umkhele
Welcome back, and let's continue with our discussion. Your Excellency, for students with a passion for very specific areas of public health, does Springfield Research University offer specialized paths within the MPH program?
Absolutely. At Springfield Research University, we understand that the landscape of public health is incredibly diverse and constantly evolving. That's why our Master of Public Health program isn't just about broad strokes. It's about equipping the next generation of leaders with the laser-focused expertise they need to tackle today's most pressing health challenges head-on. We offer several cutting-edge specializations, each designed to immerse students into high-impact areas that are actively shaping global healthcare strategies. Let me give you a glimpse. First, we have global health and infectious disease control. In a world where pandemics can emerge with terrifying speed, this specialization is on the front lines. We are talking about epidemic preparedness, the race for vaccine development, understanding the spread of disease through advanced epidemiology, and shaping international health policies that can save lives on a global scale. Our students learn to design disease surveillance systems that act as early warning signals, implement rapid outbreak response strategies, and even contribute to global health diplomacy. It's about being ready, being proactive, and being a global guardian. Then there is maternal and child health. Because building a health future starts with giving every mother and child the strongest possible foundation. This track is all about reproductive health, ensuring access to quality maternal care, understanding pediatric nutrition, and preventing early childhood diseases. We are preparing students to develop interventions that directly improve health outcomes for our most vulnerable populations. It's about nurturing life and giving every child a chance to thrive. Now, let's talk about the future. Public health innovation and technology. Technology is revolutionizing healthcare as we speak, and Springfield is at the forefront. We equip our students to harness the power of AI, digital health platforms, and telemedicine solutions to deliver healthcare more effectively and efficiently than ever before. They will explore how data science, wearable technology, and digital transformation can be leveraged to enhance public health outcomes for entire communities. This is where innovation meets compassion, where technology empowers us to heal. Of course, we can't forget community health and health equity, because access to health care shouldn't depend on where you live. or who you are. This specialization is dedicated to bringing healthcare gaps and ensuring equitable access to resources, treatment, and preventive care for underserved populations. Our students learn to develop policies and intervention programs that dismantle barriers and create a more just and healthy world for everyone. Finally, we have health informatics and policy research. In today's world, data is king. This specialization is all about data-driven public health. Students who learn health data analytics, statistical modeling, policy evaluation, and the health system research, allowing them to craft evidence-based policies that improve efficiency and patients' outcomes. This is about making informed decisions, driving real change, and ensuring that every healthcare policy is rooted in solid evidence. So, as you can see, Springfield's MPH program is designed to cultivate not just health professionals, but strategic thinkers, influential policy advocates, and technology-driven problem solvers. We are preparing our graduates to step into roles where they can tackle critical healthcare challenges, whether they are working in their local communities, across the nation, or on a global stage. We want them to be ready to lead, to innovate, and make a lasting difference in the health and well-being of people everywhere.
How will graduates of this program contribute to public health locally and globally?
That's a fantastic question. Graduates of Springfield Research University's Master of Public Health program aren't just earning a degree. They are igniting a career as leaders, innovators, and true change makers in public health. They will possess the expertise and, crucially, the strategic vision to revolutionize healthcare systems at every level. Now, how will they make this happen, both here at home and across the globe? Let me paint a picture for you. Imagine them as architects of health. So our graduates will be the policy architects, the health system managers, the strategic advisors who are literally designing the future of our healthcare infrastructure. They will be on the front lines, crafting efficient and accessible health delivery models, improving access to quality care for everyone, and building a stronger, more resilient healthcare workforce in our hospitals, government agencies, and vital non-governmental organizations. Secondly, think of them as powerful voices for change. With their deep understanding of health governance, regulatory frameworks, and policy analysis, our MPH graduates will partner with governments, international organizations, and research institutions. They will be crafting evidence-based policies that directly address health disparities, champion disease prevention, and ensure resources are allocated where they are needed most. They will be powerful advocates for a healthier world. Third, picture them as disease detectives and protectors. This program equips them with critical epidemiological skills. They will be leading outbreak investigations, leading cutting-edge prevention strategies, and contributing to global infectious disease control efforts, whether it's working on malaria eradication, preparing us for the next pandemic, or tackling emerging health threats. They will be frontline experts safeguarding our communities. See them as champions of equity and community health. Health inequalities remain persistent in global challenge, and our graduates are ready to confront them head on. They will step into their roles as community health directors, public health educators, and program coordinators, ensuring that marginalized populations receive the health care they deserve. They will be designing tailored interventions, implementing cultural competent policies, and leading vital outreach programs to reach those who need it most. And envision them as global health diplomats. Public health is increasingly a global endeavor, demanding international collaboration. Our graduates will be actively engaged in multilateral health agreements, forging global partnerships, and leading cross-border initiatives. They will be tackling critical issues like climate-related health crises, leading humanitarian health responses, and championing sustainable healthcare innovations on a global scale. Here at Springfield, our MPH graduates don't just learn public health theory from textbooks. They are trained to be action-driven professionals, health individuals who design real-world solutions, lead critical reform, and make lasting contributions to improving health outcomes for everyone everywhere. They are ready to make a difference, and we are incredibly proud of the work they will do.
Your Excellency, this all sounds incredibly promising. But can you paint a picture for us? Can you share some real-world success stories of professionals who've actually benefited from this kind of training from other countries beyond?
Absolutely, Advocate. That's where the real excitement lies. You know, it's not just about earning a degree. So it's about igniting a passion and equipping people to change the world. And that's exactly what we see with our Master of Health graduates. They are not just filling roles. They are shaping healthcare policies, driving groundbreaking research, and leading major health initiatives across the globe. At Springfield Research University, we're not just developing graduates, we are cultivating leaders. Leaders who will make a lasting impact through innovation, through evidence-based advocacy, and through truly transformative healthcare strategies. Let me give you a few examples, stories that really bring this to life. Think of the policy architects. We are talking about former MPH graduates who have been instrumental in drafting national health policies, policies that literally open the doors to health for millions, that create powerful disease prevention strategies, and that reshape how global health systems are funded. They are working hand in hand with government agencies and international organizations, ensuring that every decision is driven by solid data, improving health outcomes for entire populations. Then they are epidemiologists, the frontline defenders. These are the heroes on the front line of epidemic response. Think COVID-19 management, malaria eradication, tuberculosis containment worldwide. Their expertise in disease surveillance and outbreak intervention has been absolutely critical in shaping global health responses, saving countless lives. And what about the health innovators, the digital transformation leaders? This is where technology meets compassion. MPH professionals are pioneering telemedicine platforms, AI-driven diagnostics, and the healthy informatic systems that are revolutionizing patient care and public health service delivery. Some have even launched startups and research initiatives that are completely transforming access to digital healthcare. It's truly inspiring. And don't forget the community health champions across Africa and around the globe. These dedicated professionals are implementing grassroots healthcare projects, tackling critical issues like maternal and child health, nutritional programs, and access to primary care in underserved regions. They are improving health education, driving vaccination campaigns, and empowering communities to lead their own disease prevention strategies. And finally, consider the global health diplomats. MPH professionals are serving as advisors and policy consultants for powerhouses like the World Health Organization, Center for Disease Control, that's CDC, and the United Nations health bodies. They are helping to shape cross-border health agreements, crafting responses to refugee health crises, and fostering international collaborations to strengthen global healthcare systems for everyone. Springfield Research University's MPH program is meticulously designed to empower professionals with this level of impact. We are not just preparing graduates to enter the workforce, we are equipping them to actively shape the future of healthcare worldwide. That's our commitment, and that's what makes our program so special.
Thank you, Professor. Let's take a break and listen to a song called Springfield Hustle.
Springfield Hustle.
Sizalelwe kukhula, sakhelwe kuhola, emigwaqweni yase-Springfield sisithala imbewu. Akukho ndawo yesibili, akugcwala kuphela, ulwazi luyasiphefumulela. Somisa ukoma, ngivuke ngamandla, umhlaba ulindile, iminyango yase-Springfield ivulekile. Kusasa liqhakazile, asikho isikhathi sokumosha, sibeka izinga, sibeka izimene emasangweni, umlando uyabiza, ifa lakhiwe sidiliza izindonga. Yazikhandla, sisikho isidingo sokunqikaza, igama le-Springfield simisigcinile. Kene emasangweni, umlando uyabiza, ifa lakhiwe sidiliza izindonga. Yazikhandla, sisikho isidingo sokunqikaza, igama le-Springfield simisigcinile. Asilinde, siyahola indlela, umsebenzi onzima uyakhanya, akukho ukubambezeleka. Izinkwadi nemiqhiqo, umgomo ohlala ukhona, shintsha izimpilo nsuku zonke. Ubese uyanqamuka, isigqi senhliziyo, kungezwa nokumsulwa. Zwa umlilo, zwa umsindo, ithonselo twanje, zamazamisa umhlaba. Kene emasangweni, umlando uyabiza, ifa lakhiwe sidiliza izindonga. Siyazikhandla, siyasikho isidingo sokunqikaza, igama le-Springfield simisigcinile. Kene emasangweni, umlando uyabiza, ifa lakhiwe sidiliza izindonga. Siyazikhandla, asikho isidingo sokunqikaza, igama le-Springfield simisigcinile.
Welcome back, and let's continue with our discussion. Your Excellency, how do the faculty and students at Springfield Research University actually contribute to these cutting-edge discoveries in health policy and epidemiology? What does that look like on a day-to-day basis?
Well, at SRU, research isn't some dusty textbook exercise. It's a vibrant, hands-on quest for knowledge that actively reshapes healthcare as we know it. Our faculty and students, they are not just observing, they are in the trenches. leading groundbreaking studies that are directly influencing public health practices, revolutionizing disease prevention, and even informing the laws that govern healthcare. Think of it this way. Our faculty, the trailblazers. We are talking about nationally recognized experts. These aren't just professors. They are leading voices in epidemiology, health policy, and public health systems. They are spearheading studies that are uncovering emerging health threats, reimagining healthcare financing, and pioneering new disease intervention strategies. They ensure Springfield remains a beacon of evidence-based policy. Students, not just learners, but leaders. Our students don't just read about research, they do research. They are immersed in projects that directly impact public health. Imagine assisting in real-time disease surveillance, diving deep into health policy data, and conducting vital health assessments right in our communities. That's the kind of hands-on experience that forges true public health leaders. From the lab to literature, sharing knowledge, we foster a culture of publishing where students are empowered to co-author papers, contribute to prestigious journals, and present their findings on national stages. They graduate with a tangible portfolio of published work, instantly establishing their credibility and expertise. Let's talk global stage, global impact. Our students and faculty are regularly engaging at global health summits, epidemiology conferences, and policy forums around the world. They are exchanging ideas with the brightest minds, researchers, policymakers, and health experts, enhancing their ability to shape international health discourse and influence policy decisions at a global scale. What about partnerships that power progress? Springfield Research University has forged strategic alliances with the health ministries, international organizations, and other leading research institutions. These collaborations allow our faculty and students to contribute to large-scale studies focused on disease prevention, health system efficiency, and public health intervention that are changing lives. So ultimately, our commitment at SRU is to ensure that our students and faculty aren't just passive recipients of information. They are active architects of a healthier future, driving progress through discovery, rigorous analysis, and groundbreaking innovation. They are the future of public health, and that future is definitely bright.
Your Excellency, Springfield Research University is making waves in public health. How are you collaborating with international organizations to drive this global impact?
Thank you. Well, it's simple. At Springfield Research University, we fundamentally believe that public health knows no borders. To truly make a difference, we need to work hand in hand with the world. That's why we have forged dynamic partnerships with leading global health organizations, impactful non-governmental organizations, and government agencies. We are not just sitting in classrooms. We are ensuring our students and faculty are right there at the forefront, helping shape the policies and spearhead the research that will define the future of global health. Now, how do we do this? Let me paint a picture for you. First, imagine vast multi-country studies tackling the biggest health challenges head-on. We are talking about joint research initiatives with international health institutions and academic networks, diving deep into disease prevention, healthcare access, and understanding the spread of epidemics. Our faculty and students aren't just observers, they are active contributors, influencing global health policy with cutting-edge research. But it doesn't stop there. Think about the incredible work of non-governmental organizations and humanitarian organizations on the ground fighting for health equity and delivering aid where it's needed most. We are right there with them. Our students gain invaluable hands-on experience in real-world programs, from community vaccination drives to ensuring proper nutrition in vulnerable populations. They are not just learning about solutions, they are developing them, addressing global health challenges in real time. And what about the policies that shape healthcare for millions? Springfield is at the table, providing expert insights to government agencies, the national regulatory bodies, and public health think tanks. Our faculty members are advising on healthcare financing, pushing policy reform, and helping craft effective responses to disease outbreaks. We are helping shape decisions that impact lives across the globe. Of course, knowledge is power, and that's why we are constantly engaging in international conferences and knowledge exchange platforms. So our students and faculty are participating in health summits, epidemiology symposiums, and global health forums, ensuring our research is part of the vital global conversation. We are exchanging ideas, presenting our findings, and collaborating with the very experts who are shaping international healthcare strategies. And then finally, we are investing in the future. Through training and capacity building programs, we are working with the global health initiatives to provide crucial opportunities for students and the professionals. We are offering workshops on everything from digital health innovations to artificial intelligence-driven diagnostics and emergency outbreak response. We are ensuring that our graduates are not just prepared, but equipped to lead in the ever-evolving healthcare landscape. So SRU isn't just an institution, it's a catalyst. We are a key player in global health collaboration, ensuring our students and faculty are active contributors to international discussions, groundbreaking research, and innovative research solutions. We are not just shaping the future for public health, we are building it, one collaboration, one discovery, one life served at a time.
Professor, for someone watching at home right now, intrigued by the possibility of joining Springfield's MPH program, what exactly are you looking for in an applicant? What does it take to become part of this prestigious program?
Well, that's a fantastic question. At Springfield Research University, our Master of Public Health program isn't just a degree, it's a launchpad. It's for those driven individuals, the future health professionals, the groundbreaking researchers, the policy shapers, who are truly committed to forging a healthier future, both here at home and across the globe. Now, to ensure everyone who joins us is ready to tackle the challenges ahead, we do look for a few key things. First, a solid educational foundation. We typically seek candidates with a bachelor's degree in health sciences, social sciences, or a related area. Think of it as having the essential toolkit, the knowledge you will need to dive deep into complex health issues, understand the intricate epidemiological studies, and contribute meaningfully to policy development. But it's not just about the degree. It's about academic excellence and a thirst for knowledge. We want to see that spark, that critical thinking, those sharp critical skills, and a genuine passion for using evidence to build healthier communities. And here is where it gets exciting. We deeply value real-world experience and leadership potential. While stellar grades are important, we also want to know what you have done. Have you worked in healthcare, volunteered in a community health initiative? Maybe you have been in government or research lab. We are especially interested in professionals eager to step into healthcare leadership roles, individuals ready to craft policies and interventions that will truly make a difference. Finally, and this is crucial, we embrace an interdisciplinary approach and a global perspective. So public health touches everything. So if you come from economics, environmental science, law, or even technology, and you can demonstrate how your unique expertise aligns with public health research, policy, and innovation, we want to hear from you. At Springfield Research University, we are building a cohort of dynamic thinkers, innovative problem solvers, and true change makers. We are looking for those individuals who are ready to transform healthcare systems and contribute to the global conversation about health and well-being. If that sounds like you, then Springfield's MPH program might just be the perfect place to ignite your passion and launch your career.
Professor, Springfield Research University is making waves in public health education. How are you positioning yourselves as a leader in this crucial field?
Well, it's simple. At Springfield Research University, we're not just educating public health professionals. We are cultivating the future architects of global health. We envision our graduates not merely as trained experts, but as influential leaders, groundbreaking innovators, and powerful policy shapers who will redefine the health landscape.
So how are we securing our place at the forefront?
Let me tell you. Firstly, it begins with uncompromising academic excellence. Our Master of Public Health program isn't just a curriculum, it's a crucible. We forge a comprehensive interdisciplinary education designed to arm our students with the advanced analytical skills, the incisive policy expertise, and the research-driven solutions needed to conquer real-world health challenges. But that's just the foundation. Secondly, we are igniting change through innovative research initiatives. Our faculty and students are on the front line engaging in groundbreaking research that tackles the critical issues of our time, from epidemiology and healthcare access to global health diplomacy and the urgent prevention of emerging diseases. So Springfield is not just participating in the international health dialogue. We are driving it, ensuring our research translates into meaningful policy advancements that save lives. And how do we amplify that impact? Through our global collaborations and industry connections. We have forged powerful partnerships with top-tier global health organizations, government agencies, and non-governmental organizations, providing our students with unparalleled opportunities. Imagine them working on international health projects, shaping policy reform efforts, and conducting field-based epidemiological studies, experiences that transform them from students into seasoned professionals. But knowledge alone isn't enough. That's why, fourthly, we prioritize leadership development and policy influence. So at Springfield, we foster strategic leadership training, ensuring our graduates don't just adapt to public health trends, they shape them. Our MPH program integrates immersive policy simulations, high-stakes crisis management exercises, and robust decision-making frameworks, preparing our students for high-impact roles in healthcare governance, ready to lead from the front. Finally, we embrace the future with technology and innovation in public health. So, as digital health rapidly evolves, Springfield is integrating AI-driven diagnostics, cutting-edge telemedicine platforms, and advanced health informatics into our health education. We are equipping our students with the technological expertise they need to modernize healthcare systems and bring about a healthier tomorrow. So Springfield Research University isn't just keeping pace with the global health education trends. We are setting the standard. We are ensuring that our graduates are not just prepared for the future, but ready to lead the transformation of public health landscapes at the national, regional, and international levels. We are building a healthier world, one leader at a time.
What message would you like to give to prospective students considering this program?
So, to anyone who watching who is thinking about joining us here at Springfield Research University, let me say this. Public health isn't just a career. It's about impact. It's about having the power to shape the very policies that protect our communities, to drive the innovations that will redefine healthcare as we know it. Here at Springfield, we have built a vibrant community, a crucible where passionate individuals like yourselves can come together and forge real lasting change in the world. Are you driven to lead groundbreaking public health initiatives? Initiatives that will literally shape the future of healthcare for generations to come? Do you burn with the desire to advocate for policy reforms and finally level the playing field, ensuring health equity, access for all? Are you ready to design interventions that will stand as a bulwark against the global health threats and emerging diseases? Do you yearn to engage in cutting-edge research that will influence international health strategies on a global scale? If that's you, then Springfield's Master of Public Health program isn't just a program. It is your launchpad. It's a mission. We are not just handing out degrees. We are equipping future leaders. You, with the knowledge, the skills, and the global perspective you will need to make a tangible, undeniable difference in public health. Springfield isn't just a university. It's where leaders are forged. It's where solutions are designed. It's where real-world healthcare transformation begins. So, if you are ready to step into a future where your work saves lives, where it uplifts communities, and where it drives global health progress, then I say to you, with all sincerity, this is your place. This is where your journey begins. Thank you, Advocate, for having me. It's been a pleasure.
That's a truly inspiring message, Professor. Thank you for sharing your expertise and insights with us today. It has been an enlightening conversation. And to our viewers, if you're passionate about public health and want to make a lasting impact, explore the Master of Public Health program at Springfield Research University. Visit www.springfieldresearch.university to learn more and take the next step towards becoming a leader in global health. That's a wrap for today's episode of Springfield Career Insights. We hope you found inspiration and valuable information to guide your career journey. I am Clarence, your host. Good night.
Sonke siyavumelana ngemjululo omuhle sonke simile